Medicinal cannabis, or CBD, has recently hit the headlines in this country because of its legalization for its prescription for a variety of medical conditions. It's been used for thousands of years. However, only more recently in the UK has it been licensed to be prescribed for a few medical conditions. The actual plant from where it's derived is the cannabis plants, and the two major components of medicinal cannabis are THC and CBD. And it is the ratio of these two components of medicinal cannabis that gives you the therapeutic effects. Currently, at this present moment in time, it is only licensed to be prescribed within the NHS for a very few neurological and possible cancerous type conditions, particularly some of the symptoms that one gets with cancer. However, as an unlicensed medication, it can be prescribed for chronic pain conditions. The potential sort of effects or therapeutic effects has been widespread within the chronic pain syndrome and can be used quite significantly in certain patients, for patients who have neuropathic type pains, but also for those patients who have chronic musculoskeletal type conditions, possibly like arthritis. It's now being developed for its effect on things like fibromyalgia, and there have been quite a number of papers and research done regarding this. The drug itself can come in two formats. It can come in an oil format, which can be dropped underneath the tongue or possibly just in the mouth, and this is normally taken twice or 3 times a day. In addition to that, it can come in a flower, which can be vaped for quicker onset effects and quicker therapeutic benefits. We at the London Pain Clinic can provide both, depending on the type of problem that one has. The actual drug itself has some side effects, which I think are very important to know. In the first instance, it can cause some degree of dizziness, disorientation, and drowsiness. That's obviously due to the THC that is part of the medicinal cannabis. But the formats in which it's prescribed, and normally in the way that it's prescribed, these are very much mitigated. It can cause a bit of a dry mouth as well, and also it can cause an upset gastrointestinal system, so there can be some diarrhea possibly. In essence, it's a very, very safe drug, and in comparison to a wide variety of other medical drugs, it is very, very safe. And that's why this drug has been researched significantly for the possible therapeutic effects. Normally, as I mentioned before, particularly the oil can be prescribed twice a day, and the sort of regime with which we prescribe it is that we start at a very low dose and then we gradually increase to its therapeutic effect. Obviously, it does vary from patient to patient how much of the THC and CBD components that would be therapeutic, but it also does matter on what type of medical condition you have. But in essence, the idea is that if we start at a low dose, then we can see how it affects one's condition, and also sort of deal with any side effects. And then gradually, over the next coming weeks, we normally do increase it by a little bit at a time. And that can obviously be discussed with your practitioner. The drug itself is currently can only be prescribed by a specialist like myself and other practitioners at the London Pain Clinic, and for the time being the prices are slightly higher than we would want. Clearly, this is the beginning stages of this prescription of this drug, and clearly, in due course, we do hope that the actual prices of these medications can reduce in significance. I think it's best, if there is something that you would like to try, please get in contact with us, and we can discuss this further.